My name is Kevin S. I'm an associate professor of pediatrics and neurology at Vanderbilt Medical Center in Nashville, Tennessee, and also a neuroscientist who's interested in studying brain development and epilepsy.
I'm Al George. I'm professor and chairman of pharmacology at the Northwestern University Feinberg School of Medicine in Chicago. And I have a long-standing interest in paroxysmal disorders of the nervous system and disorders that are genetic in nature caused by mutations in ion transporting proteins. I received a call about 3 years ago from a pediatric neuro-ophthalmologist at Vanderbilt University, which was my former institution for some 21 years, who had just seen a case and wanted to know if there was any research that I'd be interested in doing on this rare and unusual disease. I had never heard about it. I never knew anything about it, so I proceeded to look up what was known and educated myself. And these were events that occurred before the gene was discovered, and I immediately became fascinated in the nature of the disease and wanted to contribute to both finding the gene and, if the gene were found, to try to characterize its properties and hope to contribute to looking for better treatments.
Sometime later, Dr. George contacted me, also interested in AHC and wanted to get more people involved. And at that time, my laboratory had been working on human stem cell research using patient samples. And we thought together that this would be an excellent way to learn more about AHC and also potentially help patients as well. We also have a common colleague, Dr. Kathy Svoboda, at the University of Utah, who we both worked with on other projects in the past, and she's been very instrumental in AHC over the years, so it was an opportunity also to work with her. Once I then became more involved in AHC research, I also wanted to learn more about it, so actually I started seeing children with AHC in the clinic I opened up at Vanderbilt Children's Hospital, and just recently we started a clinic about early 2014. I've had the opportunity to meet with multiple families. Since I opened this clinic, they've actually come to see me to see whether it can help with their child, and also I get a lot of information about their child as well. So it's really, as I said, a two-way street. We exchange information. Families always want to know the latest research findings. I like to understand better what issues, problems their children have, so I can better ask research questions and may ultimately help children like this.
So today I tried to educate the families who are attending the meeting today about the basics about the gene ATP1A3, the protein that it codes for, and where we are right now in understanding what the functional consequences of mutations in that gene that are associated with AHC. I then reviewed for them our strategy for our research activities that have been funded by the AHC Foundation over the last 2 years, to first define what those functional consequences of the mutations are, and then to try to exploit new strategies for drug discovery in looking for existing drugs that could be repurposed for correcting the underlying functional defect that leads to AHC. Well, there's some promising early results that are leading us in directions that we didn't know about before, but there's still a long way to go. And as with other rare diseases and with any drug development effort, it may take years before we really have discovered or developed novel cures. But there are breakthroughs all the time in making advances in how drugs are discovered, how new medicines are synthesized, and we're hoping to leverage those new strategies as much as possible in the quest for a new treatment in AHC.
So my talk was an extension from Dr. George's work, and we have been funded together for the last year plus to study as much as we can what the AHC-related gene ATP1A3 is doing. And one way we're doing this is we obtained skin cells from patients with AHC who have no mutations in this gene. And then using some newer technology, we're able to turn those skin cells into human stem cells, actually. It's a tremendous advance in the field. And once we have done that, we can make stem cells that are capable in a dish of making human neurons. And we're just at the level now where we've made neurons from 3 different genetic mutations of ATP1A3 that account for actually most patients known to date with the disorder. And the hope is that we'll be able to use those human neurons to really understand what the problem is in those cells. We can also use the possible treatment options that Dr. George's lab has discovered to see if that may reverse those treatments, and we can use them for other experiments as well. So it's a tremendous advance in technology that only came out over the last few years, and this is a really good time to move this field forward in a rapid way. So we're very excited about it. I think you'll see more people being diagnosed. I think now that the gene is identified and what we know is the, if you will, the classic presentation or phenotype, we'll probably get beyond that, and there'll be patients discovered who have similar forms, not completely the same. That happens, I think, in many diseases. Once you understand what the basic cause is, you can start to branch out a little bit, and that can be very exciting because then we could start to get better information about whether there's a particular genetic change that gives you a particular aspect of the disorder, and that'll help guide our therapies as well, I think, too. So I think you'll see more and more people brought into this who have maybe mild forms of disease or even something very different. We don't know, but there's other examples in neurology where things that are thought to be different disorders altogether actually are caused by the same gene, and this is a very good example of something like that.
I think over the next year or two, we're going to learn much more about the basic molecular defect responsible for AHC, and that's going to lead to improved understanding of the mechanism of the disease, and hopefully from that will inspire new treatment strategies. I think the other thing that we're going to see emerge is new animal models of AHC. There are in existence now some mouse models. More will likely emerge, but I think over the next year or two, those animal models will be exploited to learn more about the disease, which after a genetic disease is deciphered at the gene level, the next big goal is to understand it mechanistically at the physiological level. And that's where that's the next phase of research in AHC. I describe AHC as a paroxysmal disorder of the nervous system that leads to more long-standing and chronic neurological deficits.
Yeah, so I think I'm a pediatric neurologist too, and patients present with what sounds like fairly bizarre symptoms. People often think it's epilepsy, and epilepsy can be associated with AHC, but early on, these are young children. These episodes of weakness and other symptoms are very confusing to many professionals as well as to families. So I think I'd characterize AHC, as Dr. George says, as a paroxysmal things that come and go disorder that's in a differential of epilepsy and migraine. And those disorders by themselves are very interesting to both neurologists as well as neuroscientists because of things that come and go is probably an opportunity to understand why that happens and maybe prevent something like that from happening again. There's also, I think, a very important component here that it tells us how the brain works, and that's just important information to know as we move forward in the 21st century, and these genetic disorders are telling us very important things about the function of the ATP1A3 gene.
As with any rare disease, it is really important for parents to document details of their child's illness, especially when there are changes in treatments, diets, or other activities that might be triggers of the attacks or possibly are improving the attacks. There aren't enough patients in the world to do a clinical trial against any medicine. And it's going to be very important for parents all across the world to carefully document what happens to their child, when and how. And I think it's really a valuable resource to researchers to have that information directly from parents and caregivers. Without question, the more research is done on a disease such as AHC, the more progress will occur. Getting more people involved in both the clinical side of research as well as basic research can only help improve the chances of a future therapy or cure for the disease.
I think people do tend to focus on the hemiplegia, the H in AHC, and it's very obvious and it can be very distressing for both children and families. As a neurologist, actually, my biggest concern is the more developmental outcomes. Many, if not most, children with AHC often have developmental disabilities, intellectual disabilities, and the attacks themselves, why a clear sign, I'm not sure that's the end-all be-all. They may be just another symptom, and if you can stop them, that's great. But I think there's an underlying brain issue that's holding these children back from their full potential. So I'd really like to see the research move in a direction where not only more people can be involved, but the therapies can really just arrest the development of the negative parts of AHC during childhood. Yeah, that's a really tough, loaded question. I'm trying to be optimistic about it, and I think we will make progress, but it's very difficult to predict how long that would take. I hope so, but cures are incredibly difficult with neurologic issues. We just don't know enough about the brain yet to make cures. I think a more realistic goal will be to minimize symptoms, to again allow children to be as much as possible, as normal as possible, and for all of us the same goal is to live up to our potential in life.
I think the possibility of a cure or better treatments are a real possibility. Again, it's impossible to know how long that will take. But for those of us interested in research for the improvement of the lives of children with these rare diseases, such as AHC, one strong motivator of all of us is to see one day when a treatment can be realized. It may not be a cure, it might be a treatment that allows children to develop normally and have long periods of time free of the attacks that are characteristic of this disorder.
One of my hopes during my career, actually, what you just said, was to train future neurologists and tell them about this disease, that when I was your age, we had to do this, and now we just treat them with this and it's taken care of. That would be an immense possibility. We'll see.